Hey, by the way, we're probably going to have some extra time for calls, 303 Martino, and we're not sure about the apothecary if they're showing up or not, but we're on the phone with them figuring it out. But we do have someone here right now that you want to talk to, I want to talk to. And by the way, he will answer some questions on the phone as well, as he does often. In the past, you may have considered LASIK eye surgery. I had it done years and years ago. I loved it, and I still love it. I had what's called monovision because my eyes were just going bad normally. You know, as you get older, you get presbyopia, and it's like you can't see close up anymore. And they adjusted my eyes. I loved it. I went back to Dr. Dishler yesterday, and we're going to talk about that. He is here right now, and I'll tell you what, he's got with him his nurse and patient counselor. I met you yesterday, Dana Calkins. And Dana, what do you do there? And Dr. John Dishler's here, of course. Didn't mean to go right over you, but
No.
What do you do?
I'm Dr. Dishler's patient counselor.
What do you do?
What I do is I meet with patients after they have been qualified as a candidate for LASIK, and then I give them a tour of the surgery center, talk with them about their options, and basically make sure that they're making the right decision for themselves.
You're the softest sell on earth.
Yes, that's true. I think if they come in and they're interested in LASIK, then you know, they're in the right place. They know that the qualifications of Dr. Dishler. So it is really easy to explain to people that, you know, he's so fabulous and they can't get better care anywhere else.
But when I say a soft sell, meaning sometimes you've told people, well, you don't really need it right now.
We definitely have. There are times where people should not have LASIK surgery. You know, extreme dry eyes, or for other reasons, they shouldn't have LASIK surgery.
And you can work with them, though.
We try to work with them and get them to the best vision that they can have, but sometimes that's not with LASIK.
Now, of course, most of the time, LASIK has incredible benefits. And I went there because I wanted to get that. I thought maybe I need a touch-up after all of these years. And Dr. Dishler, I mean, what's amazing to me is you took care of my eyes in 10 seconds. You said that I wouldn't notice anything for a little while. They put some plugs in. Can you explain what they are?
Well, the eyes make tears, and what we do for people is we put in these punctal plugs that
if they have dry eyes.
If they have dry eyes, as one of the treatments for dry eyes to help keep more of their natural tears. There's all these supplements. You were talking about supplements and different things earlier, but they're all, as you said, artificial. It's best to have your own natural tears in your eyes, so we can just plug up the drainage of the eyes and keep more of your natural tears in there. And that, for many people, improves their quality of their vision, their comfort of their eyes. And sometimes we need to get their eyes prepped before surgery, or sometimes after surgery. That's all that people need, is just a little treatment for their dry eye. You know, Dana, we should call her a patient concierge as much as a patient counselor. You know, so many places have people as patient counselors. Last week they were working selling used cars, and this week they're... Dana is a registered nurse. She's had the surgery herself. She's scrubbed in surgery, running the lasers, qualified to run the lasers, qualified to be a scrub technician and a scrub nurse. So she really knows every aspect of what we do, as well as taking care of the medical history of patients, what medications they're on, what allergies they have. You know, we are careful not to give patients medications that they might be sensitive to, all those things. And so she just provides, to me, I'm just so proud and so happy to have her with us. And you know, one of as you mentioned, one of the awkward things is, what do we do when we see a patient that says, I was at Center X, and they told me I'm a great candidate for LASIK, and we don't think that maybe they are. How, you know, how do we handle that? How can we delicately say, well, we don't really think so? And that's why we say to people, you know, put us in your short list if you're thinking about LASIK or vision correction surgery. Whether you come to us or not, at least come, we'll give you an honest appraisal. And we may say no. We tell probably 1 out of 5 or 6 people, we don't think this is good for you, or we don't think this is good for you right now, or this isn't going to solve the problem that you want solved. So it's very important, and she's this sort of connection between the lay person and the medical world. She's kind of that interface that's just so important to have, and our patients can contact her directly through email or through her phone number and that sort of thing.
Dana, what are the potential concerns? What are the concerns that potential patients have, basically?
I think a lot of people talk about, well, this is my eyes. You know, I'm scared because this is my eyes. And I hear that a lot. And I think as long as people, I think my job is to explain to them that you need to be comfortable in the surgeon, in the care that you're going to receive. And we want patients to feel comfortable before surgery in knowing that they've made a good decision.
In fact, they're almost interviewing you during this process, aren't
Absolutely,
they?
they
You
are.
let them ask anything they want about the entire practice.
Absolutely. We've had patients that have gone to see the doctor, one of our doctors that meets with the patients. They've talked to Dr. Dishler, and then they come to me and they ask a lot of the same questions just to make sure that they're getting the same answers.
You want people to meet your team, observe what's going on here in the office.
Yes.
It's a very open culture, open office. You can observe anything. You can ask for a tour, and that's what I like. And I like that you explain everything. As I said, Dr. Dishler, I was there yesterday as a patient, by the way, and I thought I might need a touch-up, and you said I wouldn't notice anything with those dry eyes. I noticed this morning when I woke up immediately that I could see better in the morning, because it used to take me about an hour because my eyes were so So I noticed immediately.
Oh, that's great.
Okay, because you said it might take a few days.
Well, it's better to, you know, under-promise, over-deliver, right? You know?
But I noticed because I was sleeping, woke up, and I could see better than normal.
That's great.
So as it turned out, I didn't need really a touch-up at all. I had dry eyes. You never know what's going on with your eyes. In fact, you know, he had concerns about my wife when she was talking about her eyes and didn't think that was going to help. And because of that, we had that sugar diabetes test. So there are so many things you guys check for. It's amazing to me.
Well, the eyes are, you know, it's part of the body.
You're a surgeon. You're a doctor.
I went to medical school, and I did an internship and all those things, because it's all intertwined, and we have to take into account the person's whole body and everything, not just this one little aspect of it that's so important, but that it interfaces with all these other things.
And we're talking about your skill, and we're talking about, you know, being a doctor, being a surgeon, but also the technology there. I mean, I don't know if you constantly throw money at it, but you always have the latest stuff. I mean, I couldn't believe you walk in and you blink, say, okay, move to the next one, and I'm thinking, what did you just do? You're mapping my entire eye with 3 machines.
Right. Yeah, we have technology to map the eye in a lot of different ways, to look at how thick it is, the shape of it, how much it matches a database of normal eyes to see, is it normal, is it abnormal?
No guessing.
And no guessing, very, very scientific. And so that's really, really helpful to get a lot of information, you know, beyond what people think of with an eye exam, where they're saying which is better, number 1 or number 2. It's way beyond that in many ways. And we can learn a lot before the person even answers any questions and goes into the traditional exam room and has a regular eye exam, which we also do, and that's important. Now,
we have Dr. Dishler here. Maybe a few minutes he can stick around if you have calls, 303-Martino. We may have a little extra time. Now, this is the special. He has $3,100 both eyes. Now, keep in mind, this is all custom LASIK. It's all the pre-care, all the aftercare, the procedure, everything you need. And here's the greatest part: 24-month financing, 0% interest with approved credit. You need to call for this. This is a true deal. There's really no one that can do the same exact treatments for the price or lower. They can't. So check it out. 303-793-3000, 303-793-3000, or Dishler.com. Paula?